I'm Pauli. I'm a mom, a wife, a pelvic floor physical therapist, and founder of No Kegels University. I have helped thousands of women stop leaking, enjoy intimacy, and feel proud of their bodies, even after having kids. After years of listening to women wonder why no one talks about leaking, how they should properly recover after having a baby, and that pleasurable intimacy is possible, I started to get real frustrated because I believe that no mom or woman should struggle when there are answers. It became my mission to shed light on the lack of postpartum care and the lack of discussion on issues that relate to women and their health, even if they can be uncomfortable sometimes. It also became my mission to change the conversation on women's health, the pelvic floor, and more. Here we go. Episode 48, Reasons You Aren't Strengthening Your Pelvic Floor. A couple years ago, I had a patient come into my clinic, and before we could even get started, she said, "I don't think that there's anything that you can do to help me. I do my Kegels all of the time. So I leak, and how are you going to help me?" And I was a little taken aback by her abruptness, and I don't really care for Kegels. And so I just wanted to take a step back and ask more questions just to see where she was coming from. And so I asked her some questions, and I was able to get a couple of pieces of information out of her, like she does around 200 Kegels a day. She leaks anytime she goes up the stairs, with intimacy, with exercise, with laughing, coughing, sneezing. And I believe there were a few other instances where she leaked or lost control of her bladder that, while I don't want to discount what she was experiencing, they were very minor activities, but she would have a large urine loss. She would leak or pee her pants quite a bit. So the one thing that comes to mind is I remember she would say if she would jump, like if her husband startled her, she would almost totally lose her control of her bladder. And so there are just little things like this that aren't pretty common that women have leakage with, but she seemed to have leakage a lot. And she was so bent on the idea that she already did her Kegels and there was no way that I was going to help her. And I continued to ask more questions and was honestly kind of confused. Well, if you're so convinced that Kegels are it, but you're not getting where you need to be, then I was confused why she was there to see me. So I asked her, well, can we take a look at your pelvic floor? Can we see? I just, for someone who does 200 Kegels a day, I just want to make sure that, I want to see a pelvic floor like this, because in all honesty, right now at the time of the recording, I've been in practice for over 13 years, but since then there was maybe only 2 pelvic floors. Now it's been 3, full disclosure. I've only ever assessed 3 pelvic floors that did not need me. And so I thought, I bet she might be one of them. Possibly. I just was really kind of confused, to be quite honest. And so when I was assessing her pelvic floor, when I would ask her to contract her pelvic floor or to do a Kegel, rather than pulling her muscles up and in or allowing them to shorten or to contract, they would actually bulge out. They would do opposite. So let me give you a quick insight here in case this doesn't make sense to you. So if I know sometimes that there's those that like to use the phrase, pretend like you're taking your vagina and your anal opening and you're going to pick up a blueberry and lift it up and in, right? So it's that shortening motion, which I have so many problems with that analogy, but you get the idea that those muscles are going to shorten and they're going to rise up. Well, instead of doing that, it was like someone was taking all of this pressure and stretching out those muscles and lengthening them. So they were doing absolutely opposite of what they were supposed to be doing when she asked them to contract. And when I saw this, it made so much sense to me, which I'll explain here in a minute. But I was really nervous about how I was going to explain this to her, that number one, she wasn't even doing these Kegels correctly. And number two, all this time and all this effort that she put into it, it wasn't helping her. But then number three, she was so convinced that I wasn't going to be able to help her, that I really didn't know if she was going to believe me, if she thought that I might be making this up. So thankfully, our conversation and the end of our visit went really well, and it was received well on her end, which I was so thankful for. And it really was incredible to be able to watch her do and strengthen that pelvic floor and really make a significant amount of progress in a short period of time. But I tell you this story, number one, it's more evidence because I don't like Kegels. I don't think that they work. And most of the time, people don't even do them correctly. But here this sweet lady was trying to do the Kegels, trying to do everything that she thought, and it wasn't working. And she was actually making it worse. And it was one of those moments where I don't know if this makes sense to anyone, but if you can think about it, when you go to stand up, your knee straightens out. And the reason your knee straightens out or extends, however you want to think about it, your quad muscle, the thigh muscle in the front, it tightens. So anytime your foot hits the ground, like when you go to stand up, that knee straightens and that quad or the front of your thigh muscle contracts and tightens, so you're standing up. I want to quickly interrupt and tell you it's here. Bye Bye Leakage, the comprehensive program for pelvic floor strengthening. I recently updated it and I can't wait for you to join. I want you to stop doing Kegels and wondering if they're even working or if you're doing them right. You deserve to know how to effectively and successfully strengthen your pelvic floor, stop leaking when you cough, laugh, jump, sneeze, have pain-free intimacy, improve your energy, and feel proud of your body, even after having kids. Bye Bye Leakage is well worth over $3,000, but I'm offering it to you today for less than a quarter of that price. There are 12 sessions, and each session outlines the same programming that I have given to my patients in the clinic for the past 13 years, where thousands of women have gotten the results that you're only dreaming of. Each session is full of exercises, tips, tricks, and trainings. There's even roadmaps included in Bye Bye Leakage for pregnancy, postpartum, and prolapse. This program has been designed to give you a framework to last you a lifetime. I've also included 3 bonus programs just for you: End of the Urgency, Trampoline Strong, and Diastasis Recti 101. You can get it in the show notes, on my website, or in the link in my bio on Instagram at BeyondTheV by Pauli. And imagine with me, instead of that happening for this gal, let's just say her quad muscle was doing opposite. Anytime she went to stand, rather than her knee going straight and her quad muscle tightening, it did the opposite. It relaxed and that knee bent, which you can imagine that's kind of a problem. If you're trying to stand up and your knee is giving out every time, well, your knee and your muscles are doing opposite. And this is what was happening with this gal. And so I tell you this because hopefully I have your attention that Kegels don't work, but also I wanted to give you some reasons of some other things that you might be doing that you might think you're strengthening your pelvic floor, but it actually is probably laying a really poor foundation and or slowly laying a foundation of a lot of bad habits. So let me give you 4 different reasons. Number 1, contracting or holding right before you perform a repetition. So this could go for your core or this could go for your pelvic floor. I know sometimes in Pilates or some fitness classes, I don't know if they often do this in weight classes, although I wouldn't be surprised, but they will cue you to contract your core or your pelvic floor before you squat or before you lift or before you. And the interesting thing with this is the research is telling us that that's not actually how it works. That our pelvic floor will turn on at different times and at different activation levels depending on the activity. So to assume that our primitive brain, if you will, not our primitive brain, I'm sorry, our conscious brain, our conscious mind knows when that pelvic floor is supposed to contract. Well, that's a really silly assumption, and something where that anytime you go to lift something heavy, that pelvic floor tightens and stays firm. It doesn't give like it's supposed to. Because if you can imagine on a car that has shock absorption, part of your pelvic floor's role when we lift something heavy or when we jump is to act like a shock absorber to some degree. So rather than doing that, I would really encourage you not to. Just breathe regularly. The next is Kegels. And I know that I've touched on this because I'm in the beginning story, but I wanted to talk a little more about this part because oftentimes women will come to me and say, well, I am doing my Kegels and I know I'm doing the right way because I checked or my doctor checked or what have you. But to be quite honest with you, and I feel like I am a broken record saying this, there is no other muscle group in our body that we squeeze and relax and squeeze and relax. There's no other muscle group that we do that with except the pelvic floor. And to me, that shows such a lack of understanding of how that pelvic floor actually works. And yes, I know that doctors will tell you to do them, but I also wonder too, how much do they know about the pelvic floor? To be fully transparent, when they perform an exam, their speculum that they insert, it covers up all of those pelvic floor muscles. And I'm not saying that a doctor couldn't be knowledgeable on this, but if they're recommending Kegels, I really have a hard time believing that they really understand what the pelvic floor is capable of and may not even have an understanding of exercise physiology and the methods behind strengthening muscles. Because again, no other muscle group is getting strengthened by squeezing and relaxing and squeezing and relaxing. Now, maybe in the beginning after a surgery, but no one is continuing that way. So Kegels, I would quit. And I'll give you a few more options at the end of this if you are interested in what you can replace your Kegels with. And the last thing is exercising and leaking at the same time. I'll be honest, this one is kind of a gray area. And the reason is because I'm never going to tell someone not to continue exercising when they're leaking, especially because to some degree, that's a quality of life for them that they enjoy exercising and they don't really want to give it up. But on the flip side of that, and this is why I feel like it's such a gray area, the fact that you're exercising and leaking, you are not getting that pelvic floor any stronger. Because when you're exercising and leaking at the same time, that tells us that your pelvic floor is not strong enough to tolerate what you're asking it to do. And I actually had a patient respond to me saying this in the clinic last week. And she said, well, but the rest of my body is strong enough. And I'm laughing because I thought, well, yes, but if you broke your arm and it was in a cast, and would you, start strengthening that bicep like you did prior to you breaking it just because the rest of your body is strong enough? No, we probably wouldn't. We would give it time. We would give it the appropriate amount of, advancing those exercises with time and with variety of exercises, utilizing those principles of strengthening and exercise physiology to help us get the results that we want. And I want to sum up this episode with, I know that I am probably being very polarizing on a lot of these topics. And I know that. But here's what I also know. I have had thousands of women that I have helped over the last 13 years, and they have all come to me after trying Kegels, after failing other programs, after being so frustrated. And I offer to you another way, a way that only takes 10 to 15 minutes a day, that allows you to even do most of these exercises while you're performing other household tasks, or while you're with your baby or with your kids, or easy enough to tack onto your workouts that you're already doing. And I offer this to you because when there's answers and there's an easier, more efficient way, as mothers, and because I am one, I understand this because I'm one of you too, that we deserve this and we most absolutely need something like this. There is no reason that we continue waving the flag of martyrdom that we've sacrificed our bodies and then now we won't ever get it back. Well, yes, you won't ever get that pre-baby body back, if you will, but how about we say we can get back our body and how it functioned before we had kids. And I'll even add here that most of my patients feel stronger than they did before having kids by the time they are done working with me. And for this episode's homework, if you will, is I want you to grab, if you haven't already, the 3 reasons why Kegels don't work and what will guide. It's in the show notes. If you haven't joined No Kegels University Sorority, it's my free group on Facebook. The link is also in the show notes. And I do weekly trainings, weekly pelvic floor exercises, challenges, and discounts there that I don't offer anywhere else. So be sure to join. And like I said, it's all free. And if you're ready to jump in all the way, be sure to check out my program, Bye Bye Leakage, a comprehensive plan for pelvic floor strengthening. And this is the mama of them all, the daddy of them all. This is such a beautiful course that will serve you throughout your lifetime. And I encourage you to take a look. And if there are questions on your end, you are welcome to book a call. It's called Your Pelvic Floor's Next Step, which is also free. And there are several options for you, no matter where you're sitting, no matter what your story might be. There's something for everyone. And with that, remember, you're an heiress and a queen and everything in between. If you enjoyed this episode or even wondered if I can help you, check the show notes for more details. And to see what else I'm up to, follow me on the socials at BeyondTheV by Pauli. Because I'm changing the conversation on women's health, the pelvic floor, and more, I still need your help. Please subscribe, leave a review, and share with a friend or two. See you next week.